visible? Let me know, then we'll start. Am I audible and visible? Let me confirm. Am I audible and visible? Am I audible and visible? Let me know, then we'll start. Okay, fine. Am I audible and visible? Okay, fine. Hello everyone. Welcome to Unacademy Future Doctors. I'm myself Dr. Dipti Kariya. I'm MD PhD Physiology and I'm your faculty for Physiology. Now, let me explain in brief about our subscription and then we'll continue with today's topic, that is cardiac efficiency test. So first announcement here is we are providing, Unacademy provides you PG notes, and that is comprehensive notes for next that is NEET 2023. These notes, they are given to the students, those who have more than 12 months of subscription. Okay, so stay tuned with us to get the benefit. Another, if you're taking 1 year subscription, you will get 6 months subscription free. So this is also one of the other important thing that you can get. One year subscription. On 1 year subscription, you are getting 6 months free, and this is by using my code Dipti10. Okay, yeah, okay, fine. Now, next announcement, as you all know that we have Plus and Iconic subscription. In Plus subscription, you can choose the best from the best. Here you can access both live and recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. You can study on the device of your choice. You can compete in the live test as well as quizzes, and you can access question bank, which is having more than 25,000 questions. Okay, now other is Iconic subscription. Here your access to the best from two of the best, and which are these two? One that is Unacademy and Prep Ladder with Unacademy, and other that is Unacademy and Prep Ladder with Prep Ladder. Here the features of first I have already explained, and features of Unacademy and Prep Ladder with Prep Ladder, they are: you can have clinical and integrated essentials, video lectures from the Dream Team, question bank 3 with active guidance system tag, and more, rapid revision and snapshots and treasures in 2021 Dream Notes. Also, we are launching on Unacademy Lite for NEET PG. Here, this is NEET PG test series. Overall, 450 plus practice test, which includes subject-wise test series for all 19 subjects. You are going to appear in NEET, okay, as well as system-wise test series with all these 19 subjects, as well as full-length mock test papers are also given. Previous year question papers are also given. Test series curated by top educators, that is also one of the important feature. So 90 plus grant test including NEET PG, INIC, CET, FMG, grant test wise PYQ series also we are launching. These are our NEET PG September 2021 toppers and FMG toppers. Okay, now special class features. The Unacademy made the special class interactive and live. Uh, we have a facility poll for the learners. Raise a hand facility is also available. You can never miss a class as you are always notified for the class. You can get lecture notes. You can download PDF notes for the lecture, and you can access the class anywhere and at any time. Okay. Next is some of the batches they have been started. They are from March 2nd to May 2nd. We have 2 months batch for NEET PG 2022, and this is PYQ batch, previous year question batch. You will be given all the previous year question papers. Focus FMG batch also for 2 months from 2nd March to 2nd May. For 9 months also Focus FMG batch has been started, that is 2nd March to November 2nd. Next, if you are planning to appear NEET PG in 2023, that is next. So this is total 1 year batch, subject wise batch, that is also available. So these are all another for 2 months. All educator revision batch is also available. For 9 months also, one batch has been started from 16th Feb, and 4 months also started from 16th Feb for Focus FMGE. So these are our subscriptions, plus and iconic subscription. Any of the subscription you can get from your mobile, and if you use my code Dipti10, you will get 10% extra discount. So subscribe it now. Longer the duration of subscription, cheaper are the rates you can see here. Okay. And one of the benefit of subscription is you will be given guided education. You have your mentor, you have your educator, the person can guide you, so you can get the guided education. And on this all the subscription rates, if you use this code Dipti10, you will get 10% extra discount also. Now for today's test, you can go to app and you can generate your test. How you can take your own test. How today's test I have generated for cell physiology. You can see here how to take a quick quiz. So going to take a quick quiz option, then you enter this code. This is the code for today's test, 323817. Okay, so when you enter this code, you will enter in a quiz. Okay, at least 2 students are required to join the quiz. Fine. Okay, fine. This way. Okay, nice. Now let us come to today's topic, that is cardiac efficiency test, one of the topic for clinical importance. Okay, cardiac efficiency test. Now what do you mean by efficiency? Okay, efficiency means ability of the organ or of the individual or of the tissue. Okay, so each and every organ in our body has got reserve capacity, reserve that is extra above the normal, and this reserve capacity is used in emergency condition. It is not used daily. Suppose if you have some extra capacity to increase heart rate, increase cardiac output, so every time your heart is not increasing cardiac output, this is used during emergency condition. And in pathological condition like in heart disease or any other problem, this situation, in all this disease condition, this reserve capacity decreases. So this reserve capacity, if we wish to test this reserve capacity, these are the efficiency test. Means here what is the main aim of the test is, we want to know that how much reserve we have for emergency. Okay, and another important use of this test is, first is to know the reserve. Okay, reserve of our heart. Okay, fine. And second very important use of this test is, as we have discussed, this reserve decreases in pathological conditions. So if your test is not normal, you can say that you might have some pathology or your patient might have some pathology. So this is the use of cardiac efficiency test. One, that is to find out the reserve of the heart, and second, to find out the pathological condition. Okay, now, so here this test, it is known as cardiac stress test or cardiac diagnostic test or cardiopulmonary exercise test. Okay, so here how to test reserve capacity. To test reserve capacity, we are allowed the patient to perform exercise, and exercise is the condition where body's need increases. So when need of the body increases, body tissues, they require more oxygen, okay, more nutrients. Then what happens during this situation? When our body tissues, they are requiring more oxygen, more nutrient, our heart has to pump more. So what happens when our heart is pumping? Then we can come to know that what is the reserve capacity of the heart. Okay, so this way we can come to know the reserve capacity. Fine. So now next is, what is the importance of cardiac efficiency? Okay. This cardiac efficiency test, you can see, as we have discussed, when any kind of extra activity, when your muscles are doing any extra activity like exercise, okay, as I told you, nutrient requirement, waste product removal, oxygen requirement, all are increased. Okay, so your heart rate increases. Main thing to increase is our heart rate. Okay, yesterday we discussed in exercise physiology heart rate, increase heart rate maximum, that is equal to 220 minus age. Suppose your age is 20 years, you can increase your heart rate up to 200 if you are not suffering from any disease. Okay, so this is your increase in the heart rate when your reserve capacity is normal. Okay, and very important thing is why heart rate increases, that is to meet the extra demand. When extra demand is there, your heart rate increases. Okay, to meet that extra requirement of oxygen, removal of carbon dioxide. Okay, so increase in the heart rate. Okay, when heart rate increases, and time, very important other factor, first factor, that is to know the reserve capacity, is how much our heart, or we can increase our heart rate, very important factor. Okay, suppose somebody is having heart failure, so that the person cannot increase the heart rate up to this level. So that is one thing. Second thing to measure is time required to return the heart rate to back to basal level. That is also very important, because suppose when somebody is performing exercise, the sympathetic activity is increased. Okay, that increases heart rate, but after stoppage of exercise, how many minutes are required to bring the heart rate back to normal, that is basal heart rate, time required to achieve basal heart rate. That is also very important. That also denotes cardiopulmonary status. Okay, so these two things are important for cardiac efficiency. Okay, now here another important thing is this test also compare coronary circulation. Okay, coronary circulation at rest as well as maximum cardiac work. When our cardiac tissues are working maximum exertion, how much is the coronary circulation, and if this coronary circulation is abnormal, whenever flow is abnormal, it denotes that heart has some pathology. Okay, so this test is used, one, to diagnose ischemic heart disease. Ischemia means blockage of the coronary. Okay, so ischemia, for that we require this test. One, hello beta, hello Neha, welcome to my class. So this test is used to diagnose if there is any block in the coronaries. We all know that coronaries are the arteries. They provide nutrition to our myocardium. So when there is blockage, when there is ischemia to this coronaries, that is diagnosed by this test. Okay, that is one thing. Second, it is also important for the prognosis of patient after myocardial infarction. What is prognosis? Prognosis means progress of disease. What is this progress of disease? Suppose somebody has myocardial infarction. Okay, and after recovery from the infarction, we can come to know that whether the person is having normal heart functions or deranged, or how much derangement. So progress of the disease, that is also identified with the help of cardiac efficiency test. Okay, so this one. Now, importance of this test, one another important is here, when we have allowed the person or the patient to perform exercise. Okay, we can also increase the level of stresses means, suppose person is performing exercise, now we require to increase the workload on the heart. Suppose that normal exercise person is having all the parameters normal, so now what we do is we increase the level of stressor. How can we increase the level of stressor? We increase the slope of the treadmill. So this is the treadmill, so the slope will be like this. We can increase the slope, so that is slopey. When the person is running or walking on a slope, more exertion is there on the heart, so we can increase the stressor. That is one way. Second, if the person is doing bicycle ergogram, speed of the bicycle, resistance also can be changed, and by that way we can also change the stresses. Okay, another important thing, suppose the person is bedridden, the patient cannot use legs, so what can we do to test the efficiency? We can allow the person to perform exercise with the help of arm. Okay, so arm exercises are advisable. Another important thing, that is advised to the patient, that they have not to stop the exercise suddenly. Gradually the intensity is reduced and the exercise is stopped. So this is the way how the exercise is to be performed. Okay, now first of all, in our clinical laboratory, in physiology, if you are a student of first MBBS, which are the tests we are supposed to perform in laboratory, our clinical lab, as a part of cardiac efficiency test. Okay, so first I will discuss test which we are performing in physiology as a first year student with the help of minimum instruments. Okay, and second thing, afterwards we will discuss how the test will be performed in clinics. Okay, suppose the person is there in ICU, or the person is having prone to myocardial infarction, so which tests are supposed to be performed to find out cardiac efficiency. Okay, so first of all, huh first is you have to take resting pulse rate, means before starting the exercise, pulse rate is measured beats per minute. All of you are knowing normal pulse rate is 60 to 100, between 60 to 100 beats per minute. Okay, so that is first thing. After that, ask the person to do standard exercise. Which is the standard exercise? Here is the stepping exercise. What we do is ask the subject to climb up and climb down only 5 times. 5 times climb up and climb down. Okay. After that, after he or she completes the exercise, you just have to measure the pulse rate. Okay, find out the pulse rate. Suppose after exercise the pulse rate has become 110 beats per minute. Okay, then again measure the rate at the interval of every 15 seconds. Very important thing here I am telling you, don't measure the rate for full 1 minute. For 1 minute, why for 1 minute we are not measuring? What we do is we are measuring the rate for 15 seconds and multiply it with 4. Okay, to get the rate. Why we are not measuring for 1 minute? Because if we are using 1 minute time to measure the pulse, during that time pulse rate has come back to normal. So here what you do is measure the rate for 15 seconds. Suppose your 15-second pulse rate is, suppose it is 26. So multiply this 26 with 4. So you will get your pulse rate. 6 fours are 24, 2 4 to the 8, 104 per minute. Okay, fine. Then leave it for 15 seconds. Again measure it for 15 seconds. So again, suppose this is your 22. Okay, again, so this is your zero pulse rate. Okay, immediately after stopping exercise, this is the pulse rate after 30 seconds. Okay, so 15 plus 15, so 30 seconds. Okay, 30 plus 15. Okay, 15 seconds you have measured, then 15 seconds given rest. So this is 30 seconds. Then you have measured again at 45 seconds, again at 60 seconds. Okay, so this way you have to measure and find out at which time your pulse rate comes back to the resting pulse rate. Suppose resting pulse rate is 80. Okay, find out 80 per minute. Find out at which time your pulse rate becomes 80. So this is the procedure to test efficiency. Normally within 3 minutes after standard exercise the pulse rate comes back to normal. If it is not coming back to normal in 3 minutes, you can say that some pathology is there. Okay, so this is first test. Second is hoping test. Here the name itself suggests ask the subject to hope, and the frequency that is 20 times. Okay, that 20 times hoping for 6 inches around, if he or she can. Okay, then after again same thing is there. After, first of all, take basal pulse rate. Okay, basal pulse rate, suppose basal pulse rate is 80 per minute. Okay, then after stoppage of exercise, immediately at zero time you start measuring pulse rate for 15 seconds. Okay, your pulse rate is, suppose, 26 in this 15 seconds, so multiplied by 4, then you will get 104 per minute. Okay, then again after 15 seconds take it for 15 seconds, so this is 30 seconds. So after 15 seconds is this much, 30 seconds, then 45. Am I clear to all? So this way we have to count the pulse till the basal pulse is achieved. Okay, now, next is how to calculate work done. Suppose for work done calculation, we have allowed the person to perform the exercise. Initially, standard exercises were performed. Now, afterwards, ask the person to perform stepping exercise 12 times per minute, 15 times per minute, 20 times per minute, and 30 times per minute. And the same procedure is repeated. Count the pulse rate again after completing the pulse rate. Just find out the time when the pulse rate becomes normal. Now, how to calculate work done? Suppose some person, some subject or some patient is doing 12 times stepping exercise per minute. So work done, we are getting work done from the formula. Here you can see for the work done formula is body weight in kilogram. Suppose the weight is 50 kg. Okay, multiplied by height of the step. Suppose height of the step in centimeter it is 50 centimeters, so meter is 0.5. Multiplied by rate of exercise, suppose your rate is 20. So this is your work done. Work done from unit is kilogram meter per minute exercise rate. So this is the formula for work done, and this way you can calculate work done in any of the exercise. This is the formula: body weight in kilogram multiplied by height of the step in meters multiplied by rate of the exercise. So this way you can calculate work done performed during stepping exercise. Okay, now another important is Harvard step test. This is the you can see the goal. This is the standard test which we are performing in the in lab, our clinical lab. Okay, so what we have to perform in the Harvard step test, I will explain you here. Ask the subject to step up and step down. Here in Harvard step test we have two steps like this. Okay, so ask the subject to step here and this two. Okay, and the height of the bench, that is 50 centimeter, or it is known as 0.5 meters. Okay, and ask the subject to perform this exercise 30 times per minute for 5 minutes. Okay, and then at the end of exercise calculate the pulse rate, recovery pulse rate between 1 to 1.5 minute, 2 to 2.5 minute, and 3 to 3.5 minutes. Okay, all this pulse rate is taken. Now after that you can calculate fitness index. This is given in your journal also. If you are first MBBS student, you have to perform this exercise in the lab. Okay, so how to calculate fitness index? This is also important. Duration of the exercise. In second, duration we have allowed the person to perform the exercise for 5 minutes. So duration is 5 minutes multiplied by 60 seconds. Okay, so this is 5 6 are 30. 300 multiplied by 100 second multiplied divided by 2 into sum of the recovery pulse. Means recovery pulse is this between 1 to 1.5 minutes, 2 to 2.5, and 3 to 3.5 minutes. So whatever pulse rate you are getting, you just add all these three, and by this formula you can calculate fitness index. Now this fitness index, if your value is less than 15, then you can say that this is poor category. Okay, when the value is less, you can see this pulse rate is more, the value will be less. Okay, pulse rate is less, the value will be more. So when the value is between 50 to 80, then the fitness is average category, and if the value is more than 80, you can say that fitness is very good. So this way you can calculate fitness index by Harvard step test. Okay, now here, three grades of exercise can be performed. One is mild, moderate, and severe in Harvard step test also. One, that is mild exercise. What we are performing in the mild exercise, ask the person to step only single step. As I told you, Harvard, this is not the standard Harvard step test. I got this kind of this stepper is we have. So ask the subject only to climb up and descend. Single step 20 times. That is per minute. This is mild exercise. Only for 1 minute, 20 times up and down, the person has to perform. First of all, take the basal pulse rate, then count the pulse rate at the end of exercise. Okay, and as I told you, at the interval of every 15 seconds, you have to calculate the pulse rate. You have to count the pulse rate. Okay, and find out the duration to achieve basal pulse rate. Suppose after 3 minutes the basal pulse rate is achieved. Basal pulse rate is 80 per minute, and after 3 minutes of this exercise basal pulse rate becomes is reached, so you can say that the fitness is normal. So in this mild exercise, normal individual gets basal pulse rate within 3 minutes after completion of exercise. Okay, fine. Second is moderate exercise. What we are performing in the moderate exercise, ask the person to climb 2 steps up and down for 20 times in a minute. Again, other procedure is same. Afterwards, count the pulse and find out the time required for the basal pulse rate to achieve. That is, normally it is between 3 to 5 minutes basal pulse rate is achieved. If it is not, then you can say that there is some pathology. Okay. And severe exercise, in severe exercise, ask the subject to climb up and down 2 steps as much as he or she can. Okay. Again, other procedure is same. Count the pulse rate at the end of the stepping test and find out the duration to achieve basal pulse rate. Okay. And here also work done, if we wish to calculate work done, what is the formula? Same, weight of the individual divided by height of the step and multiplied by rate of stepping. Okay, so weight is suppose 50, height is 0.5, and rate, suppose this is maximum, he could step up and down 30 times. So this will be your work done. So this way you can calculate work done also. Okay. Now, so this is about, these are the exercises which we are allowing the person to perform in the clinical laboratory of physiology. Now, in uh, clinics, in hospital, which type of tests are required to find out cardiac efficiency? So first and foremost test, that is TMT, treadmill test. Okay, here when the person is allowed, first of all, resting pulse rate, heart rate, blood pressure and ECG is taken. Okay, after that the person is allowed to walk on the treadmill, and along with that you can see here all the leads and the monitor, they are attached to the monitor. So the physician can monitor heart rate, pulse rate, blood pressure, okay, and ECG. Okay, so continuous monitoring of this is to be taken while performing this exercise. Okay, treadmill test. Now, so another important thing here, whenever physician feels that there is any symptom that appears, like chest pain the person has, or the person is having palpitation or dyspnea, difficulty in breathing, in all the situations the test must be stopped. Okay, another important thing, echocardiography also can be performed before test and after test. Okay, that also gives you idea about the functioning of the heart. Now, next is stress echocardiography. Now, what is stress echocardiography? Here, this test is accompanied with the echocardiography. In that, what we are supposed to perform? In echocardiography, we are just have to perform echocardiography before test and after test. Okay, so before test echocardiogram is taken, and then after test also echocardiogram is taken, and we just have to compare these two to find out any structural difference during exercise are present or not. Okay, fine. Another important thing here, sometimes if the patient is not cannot be able to perform the exercise, so in that condition chemical stress test is given. Chemical stress test means here the chemical is injected like dobutamine. This dobutamine is injected, and after injection of this dobutamine we have to take the stress test. Okay, and we can come to know that whether this echocardiographic changes are there or not. Okay, so post and pre stress echocardiography is taken. Now, next is cardiopulmonary exercise test. This was also cardiopulmonary exercise test. This is to measure breathing gases along with stress test. So here you can see gases, normal gases which are present, oxygen and carbon dioxide concentration, that is also to be measured in inspired air, expired air, alveolar air, and in the blood. Okay. Why do we require this cardiopulmonary exercise test? That is, suppose the patient is having dyspnea, difficulty in breathing. So, if we wish to find out that the cause of dyspnea is cardiovascular or respiratory, so we have to perform this cardiopulmonary exercise test. Okay. Then next is before heart transplantation to find out whether the cause of dyspnea is cardiac, then we have to perform this cardiopulmonary test. Okay. Another is prognosis and risk assessment for heart failure patient. Also, this test is important, and it spots person in to find out to measure the maximum oxygen VO2 max. Okay, oxygen maximum oxygen consumption of athlete, that is also find out by this cardiopulmonary exercise test. Okay, next test that is to be performed is nuclear stress test. Here what we are doing is radio tracers, they are injected first. Okay, and after some time, you can see here radio tracer is injected, and after giving proper time for the distribution of the radio tracer. Okay, gamma camera, you can see there is a gamma camera in which the person is allowed to enter to capture the image regarding blood flow. Okay, so and this is also to be performed before and after exercise, and here we can examine the state of coronary artery blood flow to the through the coronary artery by this tracers. Okay, next is, what are the uses of this test? Treadmill test. This is important test which is used in the patient with medium risk of coronary artery disease. Suppose the person is having risk of coronary artery disease, like the person is overweight, okay, obesity is there, person is having family history of coronary artery disease, person is having hypertension, diabetes mellitus, okay, high cholesterol, plus obesity and family history. So in those patients, this TMT test is very important to find out that whether the person may prone to develop myocardial infarction or not. So this is one of the very important use of treadmill test. Okay. Second is perfusion stress test, means we are perfusing the substance, and we are just measuring the stress test. That is also important for it is appropriate for the patient having abnormal resting ECG. If a resting ECG is itself is abnormal, so we can do this perfusion stress test. Okay. Now, what are the adverse effect? Adverse effect of this test. Sometimes patient may have palpitation. Palpitation means patient is aware of his or her own heartbeat. That is palpitation. Patient is aware of his or her own heartbeat. Okay, the patient is also having chest pain. Myocardial infarction may be during the test. Breathlessness also may occur. Headache, person may have nausea, vomiting, fatigue. These are all the adverse effect. Okay. Sometimes the stresses which we are using, that is carcinogenic. So they may also produce carcinoma. Okay. So this is also one of the adverse effect of the test. Now, next is limitations. We have not to perform this test in the patient is having atheroma. Already you can see here plaque formation is there. So there are chances of complete occlusion of the blood vessel. So this is not to be performed in the individual, or the person is having plaque, vulnerable plaque. So sometimes this plaque may dislodge, they form emboli also. Okay. And so chances of false positive and false negative results are also there. So these are the limitations of cardiac efficiency test. Okay. Contraindicated, if the patient is having low risk, it is not to be required to be performed in that individual. Another contraindications and limitations are, one is absolute contraindication. If the person is having myocardial infarction already in the state of blockage, then in those individuals this test are not to be performed. Okay. Another, if the person is having unstable angina, then it may aggravate, so it is not to be performed. Person is having uncontrolled cardiac arrhythmia, also it is not performed. Having valvular disease, aortic stenosis, dissection, pulmonary embolism, pericarditis, multiple coronary arterial disease, decompensated or inadequate, you can say that, or inadequately controlled congestive heart failure. If the person is having uncontrolled hypertension, also this is not to be performed. If the person is having severe pulmonary hypertension or aortic dissection, or person is acute ill, in any of this condition, this tests are not to be performed. Okay. And when we require to terminate this the test. Okay. Here, if the blood pressure, systolic blood pressure falls below 10 millimeter of mercury, means more than 10 millimeter. Suppose systolic pressure of the patient is 130, and if it falls below 120, then this test must be terminated. Or the person is having symptoms, dizziness, means uneasiness, ataxia, lack of coordination, or syncope. If the person is having anginal pain also, the test must be stopped. Also, if the person is having cyanosis or pallor, if the person looks pale or cyanos, then also it shows that the perfusion is reduced, so this test must be stopped. Okay. And in case of if the patient says that now stop the test, definitely it must be stopped. Technical deficiency means difficulty means, suppose if your blood pressure instrument is not working or ECG is not working, then also this test must be stopped. ST segment, if ST segment during the test in ECG, if ST segment gets elevated more than 1 millimeter, that is more than 1 millimeter in AVR, in V1, or non-Q wave leads. In all this, if ST segment started elevating, that means that there are chances of infarction. So this test must be stopped. Okay. And if the person is having tachycardia, sustained ventricular tachycardia, in that situation also the test must be stopped. So this is all about cardiac efficiency test. Okay. If you like my video, you can like it, you can share with all your friends, and you can subscribe the channel Unacademy Future Doctors. Okay. Unacademy Future Doctors. So uh, in and one more announcement here. On Monday, we'll be having our special class in which we will take MCQs related to all the topics which we have discussed in this week's session. So go through all these classes so it becomes easy for you to attend MCQ. We will discuss MCQs related with the circulatory shock. So MCQs I will be going to take from the topics. You can note down the topics. On Monday, we'll be having our special class at 5:30 p.m. So circulatory shock. Okay, I will be taking MCQ from the topic circulatory shock, heart failure that we have taken, cardiovascular changes during exercise, and fourth one, that is today's topic, that is cardiac efficiency test. Okay, so from all these topics we will discuss MCQs. Okay, so stay connected. Thank you all.